And finally this week, Medicaid expansion.
I've come here today to announce that the budget I plan to submit to the legislature for fiscal year 2014 will include the federal funding to provide health care for an estimated 300,000 more Missourians, men, women, and children who currently have no health insurance. It is time for us to move forward.
Missouri Governor Jay Nixon supportive of billions of dollars in federal cash to help hundreds of thousands of families in Missouri get health care, yet Missouri legislative leaders are adamant about saying no to the money. The same is true in Kansas. Now, a quick backgrounder here. The Affordable Care Act, more commonly known as Obamacare, expands Medicaid, the government's low-income health care program, to individuals and families making up to 138% of the federal poverty level. Now, under the act, the federal government would cover 100% of the costs of these newly eligible recipients for 3 years. And even after that, states would pick up no more than 10% of the costs. Almost 220,000 additional Missourians would get coverage, according to the Missouri Hospital Association, and about 130,000 more Kansans. But it's being fought in both states. Governor Brownback in Kansas is opposed. So is the Republican-controlled legislature in Missouri. Why, though, Steve Kraske?
Well, this sort of runs contrary to Republican dogma, Nick, which is that Republicans, generally speaking, tend to oppose expansions of government. There have been exceptions to that in recent years, most notably the prescription drug program that President George W. Bush put through. But this is bigger government, more money being spent from the states eventually, and a lot of Republicans aren't crazy about the idea.
And for all the talk, though, it's only going to be up to 10%. That is real money. And when you talk about that many people, in the state of Missouri I was looking at, that would be $332 million a year after those 3 years.
Advocates, of course, say that if you expand Medicaid in the state of Missouri, you will create 20,000 to 24,000 jobs annual jobs over a 10-year period, and the taxes provided by those new jobs, nurses and insurance specialists and hospital jobs, will more than cover the state's portion of the Medicaid increase. So they sort of say it's a perpetual motion machine. But there is a fundamental, as Steve points out, opposition in both legislatures to anything connected with Obamacare, period, full stop, end of story. Jay Nixon has an enormous hurdle to try and talk legislators who are philosophically opposed to this expansion to, in essence, put the state's name on the bottom line. It's a real uphill push. We'll see how well he does.
Well, do you think that some of these rural hospitals are going to start lobbying their legislators and saying, look, we need that money?
They are doing that. They are doing that now, and that's